The West Side has disproportionately been impacted by the overdose epidemic. There's a connection between historical disinvestment and substance use disorders. And so it was really logical for us to start where the problem was most acute.
We receive a referral from the officers. I explain who I am and that if I can help them find substance use treatment, that I can recommend for their release. The sergeant can release them without being charged so that they can go to treatment rather than jail.
I had a lot of bad experiences, and that made me use because I didn't know how to deal with that. Now I got somebody to talk to on a regular basis. You know, I can call anytime, they're there for me. You know, they helped me out with a lot of things. They helped me find an apartment. They helped me with food. It's just overall a very good program, because I already want to help anyway. I just used it as an opportunity to get better, and it's working.
We are able to be nimble and responsive to our public sector partners and provide them with actionable data that really does allow us to have impact at scale.
We try to take a step back and think about how we want to respond when people are arrested for possessing drugs. But what would happen if we connected them with substance use treatment, which addresses the underlying cause of drug use instead of just jail and incarceration?
It is the first behavioral health diversion program where we are directing people back into the community.
Providers specifically who sit in the police station have been so successful at connecting with individuals.
Since 2018, over 1,350 people have been connected with treatment.
80% of individuals start treatment, and over 50% are still in treatment a month later.
We've seen a whole range of promising health outcomes for people diverted at 30, 60, 90-day time points. So all of that has really started to build this policy consensus that diversion works.
The program reduces the rate at which people are rearrested in the future, potentially reducing the demand for drugs, and it's also improving public safety at the same time.
This was really co-created by the police, which we felt was going to give it strength because it was something that they wanted to do. At the same time that it created a low barrier option for people to access services that they needed. This is creating a body of evidence that can inform other programs, other models that are also diversion.
Really does try to right-size our approach to the opioid crisis to ensure that behavioral health providers are brought into the mix, that we are removing the justice system as the default solution.
I think all communities need a program like that. They make me feel like family, you know. My life is totally different today. Totally different.
I expect the diversion portfolio in Chicago, which started with narcotics arrest diversion, to expand exponentially in the coming years. It's the right thing to do on a human level, but it also reflects a judicious use of resources, of the public's resources, of policing resources. The University of Chicago Crime Lab has been one of the essential partners to helping us make that argument.